I've been attached with teaching and academics for the last 24 years, having worked at two of the major teaching institutes in Mumbai. And if you look at the annual workload that we cater to is almost more than 64,000 orthopedic OPD patients and more than 3,200 major surgeries every year. So this amount of huge workload is managed by the whole department under the leadership of our head of the department. I work as a professor and head one of the units. And in my team, I have two assistant professors and some senior residents. These are qualified orthopedic surgeons. And we have certain students of first, second, and third year who are the postgraduate residents in working in the department. So attachment to such a teaching institute is purely on basis of merit. There is equal opportunity, equal commitments, and equal pay for males and females. In fact, we get strong support and encouragement from our administration and also our professional bodies. So the work involves mainly the clinical work. So as you can see here, we have challenging cases like this girl who presented a case of congenital pseudoarthrosis of tibia at the age of 19 years. With this deformity, she had never walked. And we had the challenging task of making her up and about. So our teaching actually involves day-to-day work, and during managing these challenging cases, we teach our residents. Of course, we have to take certain lectures, formal lectures, and conduct CMEs for our undergraduate and postgraduate students. We are involved in the research and thesis work of our postgraduate students. And being medical teacher, we also have some exam-related work, like we have to do paper setting, corrections, take practical exams, vivas, and we do have some administrating work, like attending meetings, doing inspections for any new procurement or any OT setups, and etc. The advantage of working at a teaching institute in India is that I have a shared responsibility. So this is my whole team, my current unit. So I am the leader of the team, but I have a strong support staff who looks after the work beyond my duty hours. We do get vacations, and that coincides with the vacation of schools and colleges, so we can have a good family time. We do get special leaves if we have to attend conferences. We get study leaves. I did my foreign fellowships while I was a faculty taking my study leave. We have enough resources in terms of instruments, equipments, and support staff and other clinical branch support. We are allowed private practice beyond certain years of your service, and hence there's potential for growth as an individual, and you can have a good academic growth also. I personally feel that there are many more benefits personally to me. Being a teacher is a respectful and responsible status. I have the power not only to give orthopedic knowledge and skills to students, but I can also give them life lessons, like teaching them values and ethics, which is not given in any books. And you always deal with young residents, so you also remain young and youthful forever and cheerful. Being involved in teaching research allows me to make a lot of publications, presentations at conferences. Being an examiner, not only in your own institute, but you're called as external examiner, and that is a matter of prestige. And being the teacher also, only I could be a part of many of the journal editorial board and a reviewer. But let me tell you, even though I'm doing a hospital job, private practice, academic responsibilities in India, a woman has to do multitasking. We have a family system, like a joint family concept in India. So you have your in-laws, parents who are elderly, and you have the task of looking after them. In India, a lady particularly is considered to be responsible for managing the kitchen work, the studies of children. And we have so many cultural and social events where a lady, even if she's working, is supposed to be a part of. But I feel that we should see these challenges as opportunities. And at times where your orthopedic role is taking a backseat, you can utilize them, as I did in writing up. And I published 3 books when I was at a low key doing my orthopedics and playing a role of a mother during pregnancy and other times. I feel if I have to balance my work and life, one must follow certain principles. You must do proper planning, proper time management. You must realize to give priority to certain role at times. In doing this, you must have your passion. Whatever role you are fulfilling at that moment, whether it's a mother, it's an orthopedic surgeon, you must be passionate about it. You should have positivity towards what you are doing. And while doing all this work-life balance, you must be at peace with yourself, your colleagues, and don't compare yourself with anyone. Don't get overburdened and agitated. if you follow these 5 P's, I think all women can be powerful. And this I call as 5 P's of powerful syndrome. So then no matter how short you are, you may just hardly reach the height of the mic, but your voice will still be heard. And you will have wow moments when even if you are small, you will be taken care of, you will be attended to because you take the center of the stage and you are recognized for your work. Thank you so much.